What is heart bypass surgery, and what happens exactly? When cholesterol-filled plaque builds up in an artery wall, only a small amount of blood gets through. We are now looking at the heart and the main blood vessels. Here is a coronary artery, and right here inside that artery is a blockage. Because of the blockage, the part of the heart nourished by that artery is pale from lack of blood. The solution: attach another blood vessel to the blocked artery just beyond the blockage right there. The surgeon takes a spare vein from the leg or an artery from underneath the sternum or the arm. This vein or artery is called a graft. If a leg vein or an arm artery is used as the graft, one end is attached to the body's main artery, the aorta, and the other end is attached to the blocked artery just beyond the blockage. The graft bypasses the blockage. Now the blood is flowing from the aorta, through the bypass graft, and into the artery that was blocked. Beyond the blockage, blood is flowing again to all parts of the heart,